Welcome to Change in Condition, Recognizing Change in a Patient. This is a Frontline Forces training presented by Superior Health Quality Alliance, or Superior Health. The information contained in this module is intended for nursing assistants who are on the front lines of providing care for patients, or anyone providing care to an older adult in any caregiving role. Superior Health aims to empower you by increasing your confidence in watching for changes in a patient and using effective skills to tell a nurse or supervisor what you have seen. The purpose of this course is to further your learning and help you use these skills in real-life situations. This learning module, Change in Condition, is a three-part series. You are viewing the first of the series, Change in Condition, Recognizing Change in a Patient, which provides an overview of why it is important to recognize changes and what changes you might see in a patient that indicates their condition is worsening and action is needed. This topic has two additional modules in the series. The second part demonstrates a couple of effective ways to communicate changes in a patient's condition using evidence-based tools, and the third part of the series is a case study to help you review what you've learned. It is not necessary to complete the entire series in one sitting, and you can leave and return to the course at any time. By the end of this module, you will recognize the importance of knowing your patients well, be able to describe your role in observing and reporting any changes in your patient to provide the best care possible and keep the person safe, and lastly, you will be able to identify some of the common changes to watch for that should be reported to a nurse or supervisor. Outside of a hospital environment and in most supported healthcare settings, the person who sees and interacts with the patients the most are the nursing assistants. Your role is very important. It is important for you to be familiar with your patients, know what is normal for them, and recognize when something has changed. Patients depend on you and other team members to notice any changes and act on them. When a change is observed, it is important to report it to a nurse or supervisor. A change in condition could mean that they are ill or have a medical need. Reporting the change quickly with as much information as possible is key to appropriate care of the patient. When you first meet a patient, get to know them. Ask about their likes and dislikes and what they need from you. Having conversations with them is the best way to learn about them. Another way to learn is by watching them. When you are spending time with them, observe their strengths as well as what they need assistance with. Throughout your shift, check in with all your patients often. Do you know how they move, how much assistance they need, what their preferences and abilities for eating, dressing, bathing, personal hygiene, and using the bathroom are? Do you know how they communicate? When you know what is normal for them, you can easily notice if there are any changes. Sometimes noticing changes can be difficult. Some changes may seem insignificant, but recognizing subtle things and reporting them early may lead to timely treatment of medical needs. The most common physical changes involve mobility or how the person gets around. Changes to weakness, falls, urination, and bowel movements, changes in the skin, and vital signs. Let's talk briefly about what to watch for with each one. How does the patient normally get around? If the patient needs assistance, notice how much assistance they need. Perhaps they usually are independent in getting to the dining room, but today can only make it part way. Falls are another important concern. Follow your organization's protocols for any falls and report them immediately. You may notice the patient has trouble getting started ambulating or has poor balance. Notice if they seem to be walking differently than normal. They may be taking smaller shuffled steps or walk with their feet wider apart than usual. Look to see if the patient is favoring one side more than the other. Watch for any weakness in an arm, hand, or leg. Do they need more assistance than usual? Never assume someone else has reported these changes. Notice any complaints of pain or discomfort, like a burning sensation or difficulty urinating. They may show discomfort by holding their lower abdomen. Do they need more assistance in the bathroom? Are they newly incontinent? Observe if they are requesting to use the bathroom more or less frequently than normal. Watch for diarrhea, loose stools, or the presence of blood in the urine or stool. Is their odor of urine or stool considerably foul or unusual? All of these sorts of changes should be reported. It is very important to notice and report changes in the skin. While assisting the patient with bathing and dressing, you have the best opportunity to observe a patient's skin. Look for new open areas, redness, or bruises. Look to see if the patient's skin is discolored or puffy. Does the patient complain of pain, tenderness, or itchy skin? Is their skin cool or warm to the touch? Check to see if their skin is damp, whether cool and clammy or hot and sweaty. There may be changes to their overall skin tone. Notice if they appear pale or have a bluish tint on the lips or nail beds. Do they appear flushed or red? These changes should all be reported. In addition to the physical changes, you should watch for these non-physical changes as well. How is the person's mood? Are they confused, agitated, or less alert than usual? Changes in appetite, sleep, and how the person speaks or what they say can all be indicators of a change in condition. Let's look at each of these. Do you notice the patient may be socializing less or participating in activities less than usual? Illness can affect a person's mood or behavior. A patient may become more withdrawn or passive and not want to get out of bed, socialize with others, or participate in their usual activities. They may not be as talkative or seem to be inattentive. Watch the patient for new fidgeting or restlessness. Always speak to the person when approaching them, whether they reply or not. The patient may be confused as part of their normal behavior, but new levels of confusion could indicate a change of condition. Other changes to watch for include behaviors such as talking a lot more than usual or less, talking loudly, or talking in ways that just do not make sense. They may also refuse or resist care. It is common to see changes in appetite with elderly patients. It is still an important change. Changes in appetite that should be reported, including eating more or feeling increased hunger, saying the food tastes different or has no taste, changes in their food or drink preferences, a decreased appetite or not wanting to eat. Be sure to report any pain with eating or difficulties swallowing immediately. Changes in speech could be indicative of a medical emergency and should be reported immediately. Is the patient unable to speak or having difficulty talking? Newly slurred or garbled speech, having difficulty finding the right words, or not being able to name something they should know, can be a sign of a stroke or other medical emergency. Sometimes patients with a new hearing problem may be talking more loudly than usual. We all experience nights when we do not sleep as well. A good night's sleep is important for healing, restoration, and general well-being. Patients reporting trouble sleeping should have a full assessment. Any patient that is difficult to wake up should be reported immediately. They also should be assessed if they are sleeping more than usual. Does the person say they do not feel rested or are more tired than usual? Do they fall asleep in unusual settings, like the bathroom, during meals, or at activities? Pay attention to see if they say they have trouble falling asleep. Changes in sleeping patterns should be reported to the nurse. Patients know their own bodies best. It may be hard for a patient to tell you that they have new or increased pain, but watching for nonverbal cues can be meaningful. Patient complaints of pain or discomfort, or showing discomfort by making a grimacing face or grabbing an arm or leg when moving, needs to be assessed. Listen to the patient to see if he or she can tell you more about what hurts or feels different. Watch for those signs that the person may be having pain without telling you. If the patient is in a life-threatening or serious condition, you should report your observations and what the patient has told you to the nurse or supervisor immediately. Follow your organization's procedures for emergencies. If it is not an emergency, ask the patient what you can do to help them. If you can, measure the patient's vital signs. This information will be helpful for the next steps in assessing the patient. Organize your observations and anything the patient has reported and report it to the nurse. The ability to detect change in a patient's condition is important because it can prevent illness from getting worse. As a frontline worker, you know the patient best. Detecting the change depends on everyone being alerted to changes, ready to share their observations and respond to the changes. To properly assess a change, it is necessary to know what is normal or baseline for that person. You can learn to be more watchful of those you care for and notice changes. Make sure you take your objective observations or even your sense that something is just not right to the nurse or supervisor. Reporting changes keeps patients safe. Feel free to check out the following references to learn more about recognizing a change in condition. It is now time to test your knowledge. Click the link for the Change of Condition, Recognizing Change in a Patient quiz on the Frontline Forces webpage or in the YouTube description below. This material was prepared by Superior Health Quality Alliance, a quality innovation network quality improvement organization under contract with the Centers for Medicare and Medicaid Services, an agency of the U.S. Department of Health and Human Services. Views expressed in this material do not necessarily reflect the official views or policy of CMS or HHS, and any reference to a specific product or entity herein does not constitute endorsement of that product or entity by CMS or HHS.